Chapter 6. The Mechanics of Sex. 6.1 Human Sexual Anatomy and Physiology. Human sexual anatomy and physiology are complex systems that involve a multitude of structures and processes. A comprehensive understanding of these systems is crucial for grasping how humans reproduce, experience pleasure, and maintain sexual health. This section will explore the various components of human sexual anatomy and their physiological functions. The male sexual anatomy includes both external and internal structures. Externally, the penis and scrotum are the most visible parts. The penis serves multiple purposes. It is the organ through which urine exits the body and also becomes erect during sexual arousal, allowing for the delivery of semen into the female reproductive tract. The scrotum houses the testes, which produce sperm and testosterone, the primary male sex hormone. Internally, the male reproductive system includes the testes, a network of ducts including the epididymis and vas deferens, and accessory glands such as the seminal vesicles and prostate gland. The testes produce sperm, which mature in the epididymis. During ejaculation, sperm travel through the vas deferens and are mixed with fluids from the accessory glands to form semen, which provides nutrients for the sperm and facilitates their transport. The female sexual anatomy is characterized by both internal and external organs. Externally, the vulva includes the mons pubis, labia majora, labia minora, clitoris, and the openings to the urethra and vagina. The clitoris, a highly sensitive organ capable of providing sexual pleasure, is analogous to the male penis in terms of nerve endings and erectile tissue. Internally, the female reproductive system comprises the vagina, cervix, uterus, fallopian tubes, and ovaries. The vagina serves as the canal for sexual intercourse, the birth canal during childbirth, and the exit route for menstrual flow. The cervix is the lower part of the uterus that opens into the vagina, while the uterus is the muscular organ where a fertilized egg can develop into a fetus. The fallopian tubes are narrow ducts that carry eggs from the ovaries to the uterus. Fertilization typically occurs in the fallopian tubes. The ovaries produce eggs and the female sex hormones estrogen and progesterone, which regulate the menstrual cycle and reproductive system. The physiology of sexual response involves a series of coordinated neurological, vascular, and hormonal events. Sexual arousal initiates a variety of responses, including increased blood flow to the genitals, lubrication of the vagina, and erection of the penis and clitoris. These physiological changes prepare the body for sexual activity and potential reproduction. The human sexual response cycle, classically described by Masters and Johnson, includes 4 phases: excitement, plateau, orgasm, and resolution. During excitement, arousal builds as a result of physical or psychological stimuli. The plateau phase is characterized by increased heart rate, blood pressure, and breathing, leading up to orgasm, the peak of sexual pleasure, accompanied by muscle contractions and the release of sexual tension. Following orgasm, the body enters the resolution phase, where the heightened arousal subsides and the body gradually returns to its pre-aroused state. In males, this phase includes a refractory period, during which it is physiologically impossible to achieve another erection or orgasm for a variable amount of time. The endocrine system plays a vital role in sexual function, with hormones like testosterone, estrogen, and progesterone influencing libido, reproductive cycles, and secondary sexual characteristics. Hormonal fluctuations throughout life can affect sexual desire and function, as seen during puberty, menstrual cycles, pregnancy, and menopause. Sexual health relies on the proper functioning of the anatomical structures and physiological processes involved in sexual activity. Regular health care, preventative measures against sexually transmitted infections, and attention to overall well-being are essential for maintaining sexual health throughout an individual's lifespan. Human sexual anatomy and physiology constitute an intricate and integrated system that governs not only reproduction, but also the experience of sexual pleasure and intimacy. An understanding of this system is foundational to the broader study of human sex and sexuality, providing insight into the biological underpinnings of sexual health, behavior, and expression. 6.2 The Sexual Response Cycle. The sexual response cycle is a sequence of physical and emotional changes that occur as a person becomes sexually aroused and participates in sexually stimulating activities, including intercourse and masturbation. Understanding the sexual response cycle is crucial for both sexual health and satisfaction. It consists of 4 main stages: excitement, plateau, orgasm, and resolution. Each stage is characterized by unique physiological and psychological responses that prepare the body for sexual activity and subsequent return to a non-aroused state. During the excitement phase, the body begins to respond to sexual stimuli. In individuals with penises, this typically includes the enlargement and erection of the penis, while individuals with vaginas experience vaginal lubrication, along with the swelling of the external genitalia and a lengthening and expansion of the vaginal canal. This phase can be triggered by a myriad of stimuli, both physical, like touch, and psychological, such as erotic thoughts or images. The heart rate begins to increase, blood pressure rises, and there is often a general sense of euphoria or heightened awareness. The plateau phase is an extension of the excitement phase, where the changes initiated during excitement are intensified. The penis becomes fully erect, and the testes elevate and increase in size. In the vagina, the walls continue to swell with blood, and the clitoris becomes highly sensitive, sometimes retracting under the clitoral hood to avoid direct stimulation due to its heightened sensitivity. Breathing, heart rate, and blood pressure continue to rise, muscles may spasm, and there can be a flush of color across the chest or the entire body. Orgasm is the climax of the sexual response cycle and is the shortest phase. It is often experienced as a powerful, pleasurable release of tension. For those with penises, orgasm typically coincides with ejaculation, although the two processes are distinct. For those with vaginas, orgasm is characterized by rhythmic contractions of the pelvic floor muscles and the vagina. It's important to note that not all sexual encounters result in orgasm, and the experience of orgasm can vary greatly in intensity and duration between individuals and even from one sexual encounter to the next. Resolution is the phase where the body slowly returns to its pre-aroused state. For individuals with penises, there is a refractory period during which it is difficult to achieve another erection or orgasm. For those with vaginas, the clitoris and breasts return to their usual size and position, and any vaginal swelling reduces. The heart rate, breathing, and blood pressure return to normal, and there is often a sense of relaxation and well-being, although some people may experience a period of melancholy or irritability. The duration and intensity of each phase can vary widely from person to person and can be affected by a variety of factors, including age, health, emotions, and the presence or absence of a partner. Emotional intimacy with a partner can intensify the sexual response, as can certain aspects of the environment or context in which sex takes place. Communication with one's partner can greatly enhance the sexual response cycle. By expressing needs, preferences, and concerns, partners can work together to ensure that the sexual experience is mutually satisfying. This may involve discussing what stimulates each partner during the excitement phase, or how to handle the emotions that may arise during resolution. Sexual dysfunctions can occur at any stage of the sexual response cycle and can be caused by physical, psychological, or a combination of factors. Issues such as erectile dysfunction, premature or delayed ejaculation, anorgasmia, or vaginismus can interrupt the natural progression of the response cycle and may require medical or psychological intervention. Research into the sexual response cycle has expanded our understanding of human sexuality. While early studies focused primarily on physiological responses, more recent work has emphasized the importance of the psychological, relational, and contextual factors that contribute to sexual pleasure and health. Hormonal fluctuations can also impact the sexual response cycle. For example, varying levels of estrogen and testosterone throughout the menstrual cycle, pregnancy, postpartum, and menopause can affect sexual desire, response, and the intensity of orgasm. Being aware of these fluctuations can help individuals and their partners navigate changes in sexual functioning. Conclusion: the sexual response cycle is a fundamental aspect of human sexuality and provides a framework for understanding how the body and mind react to sexual stimulation. Recognizing the stages of the cycle not only fosters a better understanding of one's own sexual functioning, but also enhances communication, intimacy, and satisfaction within sexual relationships. As our knowledge of the sexual response cycle continues to evolve, it will further inform sexual health practices and education, contributing to a more nuanced appreciation of human sexual experiences. 6.3 Techniques and Positions. The realm of sexual techniques and positions is as diverse as the individuals who engage in sexual activities. These variations not only serve the purpose of facilitating sexual intercourse, but also enhance pleasure, intimacy, and comfort for the partners involved. Techniques and positions can be adapted to suit personal preferences, physical comfort, and the desire for emotional connection. Sexual techniques often begin with foreplay, which encompasses a range of activities designed to arouse and stimulate partners before intercourse. Foreplay can include kissing, touching, oral stimulation, and the use of sex toys. It is a crucial aspect of sexual activity that contributes to the lubrication and erection necessary for comfortable and pleasurable intercourse. Foreplay is also an opportunity for partners to communicate their desires and build a sense of intimacy and trust. Oral sex is another technique that involves the stimulation of the genitals using the mouth, lips, and tongue. It can be performed on all genders and is often included as a part of foreplay, though it can also be a main sexual activity. Oral sex requires attention to a partner's reactions and comfort levels, and can be a highly intimate form of sexual expression. Manual stimulation is a technique that involves using the hands to stimulate a partner's genitals or other erogenous zones. This can be a part of foreplay or an independent sexual act. The hands can provide a range of sensations through different pressures, speeds, and rhythms, offering a personalized sexual experience. When it comes to sexual intercourse, there are numerous positions that partners can explore. The choice of position can affect the depth of penetration, angle of stimulation, and level of physical intimacy. Common positions include missionary, where one partner lies on their back while the other is on top, doggy style, where one partner is penetrated from behind, and cowgirl, where one partner straddles the other who is lying down. The missionary position is often favored for its face-to-face contact, which allows for kissing and eye contact, enhancing the emotional connection. Doggy style, on the other hand, allows for deeper penetration and can provide a different kind of physical pleasure. The cowgirl position offers the partner on top the ability to control the depth and speed of penetration, which can be empowering and pleasurable. Adventurous positions like standing, sitting, or the use of props like sex swings can introduce novelty into sexual relationships. These positions can challenge partners to engage with each other's bodies in new ways, potentially discovering new areas of pleasure. Communication is essential when experimenting with different techniques and positions. Partners should feel comfortable expressing their likes, dislikes, and any discomfort. Consent and mutual enjoyment are the priorities, and either partner should feel empowered to suggest changes or halt activities that are not pleasurable. Physical limitations and health considerations may also influence the choice of sexual techniques and positions. For individuals with mobility issues, chronic pain, or injuries, certain positions may be uncomfortable or infeasible. In these cases, partners can explore alternative techniques that provide comfort and pleasure without causing pain or discomfort. Safe sex practices should be considered when choosing sexual techniques and positions. The use of condoms and dental dams can help prevent the transmission of sexually transmitted infections, STIs, and should be used especially with new partners or in non-monogamous relationships. The exploration of sexual techniques and positions can greatly enhance the sexual experience. It allows partners to connect on a physical and emotional level, explore their sexuality, and express their affection for each other. Through mutual respect, communication, and a willingness to explore, partners can find the techniques and positions that provide the most satisfaction and deepen their sexual connection. Engaging in sexual activities with more than two participants introduces a complex array of techniques and positions that can significantly differ from one-on-one encounters. These multi-partner configurations require a heightened level of communication, understanding, and consent from all involved. This section will explore the dynamics of group sexual activities, focusing on the ethical, emotional, and physical considerations of such arrangements. Group sex can include a variety of configurations, such as threesomes, foursomes, and larger groups. Each configuration presents unique opportunities for pleasure, as well as challenges, to ensure that every participant feels included and satisfied. In such scenarios, it's essential to discuss boundaries, expectations, and desires beforehand to ensure a consensual and enjoyable experience for everyone. In a threesome, where three individuals engage in sexual activity together, positions and techniques can be tailored to the preferences and comfort levels of the participants. A common arrangement is where one person is the focus of attention from the other two, alternating roles so that each participant has an opportunity to be at the center of the interaction. This can foster a sense of equality and mutual pleasure. A daisy chain is a technique often used in threesomes or larger groups where participants engage in oral sex with the person in front of them, forming a connected chain of giving and receiving. This arrangement allows for simultaneous pleasure and can be an inclusive way for all participants to be actively involved. When it comes to intercourse in group settings, positions can be combined and alternated to allow for various types of penetration and stimulation to occur concurrently. For example, while one partner engages in vaginal or anal penetration, another may receive oral sex, and a third may kiss or manually stimulate different partners. The combinations can be adjusted based on the number of participants and the types of sexual acts they wish to engage in. The use of furniture and sex aids can enhance group sexual experiences. Pieces like the Liberator wedge or larger beds can provide support and space for multiple bodies, while sex toys can be used to stimulate those waiting for their turn or to enhance the experience of those actively engaged in intercourse. It's important to address the emotional dynamics that can arise in group sex. Feelings of jealousy or insecurity may emerge when multiple people are involved. Open and honest conversations before and after the sexual encounter can help manage these emotions and ensure that the experience is positive for all participants. Safety and health considerations take on increased importance in group sexual activities. Safe sex practices, including the use of condoms and dental dams, should be diligently employed to reduce the risk of STI transmission. It's also advisable for all participants to share their sexual health status and any relevant information that might affect the group. Respect for personal limits is crucial. Each participant should feel comfortable stating their boundaries and have their limits respected without pressure or judgment. A clear agreement on safe words or signals that indicate when someone is uncomfortable or wishes to stop is essential for maintaining a safe and consensual environment. Aftercare in group sexual activities is just as important as in one-on-one encounters. Taking the time to reconnect, discuss the experience, and attend to any emotional or physical needs helps ensure that all participants feel cared for and respected. Group sexual activities can offer an expanded landscape of pleasure, intimacy, and exploration. The successful navigation of these encounters requires a foundation of trust, communication, and respect for the autonomy and well-being of all individuals involved. With careful planning and consideration, techniques and positions that involve 3 or more people can provide enriching sexual experiences that respect the boundaries and satisfy the desires of each participant. 6.4 Sexual Health and Hygiene. Sexual health and hygiene are essential aspects of overall well-being, and their importance extends beyond the prevention of disease or infection. Maintaining sexual health involves a combination of personal care practices, informed decision-making, regular medical checkups, and an understanding of one's body. Good sexual hygiene can enhance sexual experiences, promote comfort, and foster self-confidence in intimate situations. Personal hygiene plays a significant role in sexual health. Regular bathing, attentive care to the genitals, and proper toilet habits are fundamental to preventing infections and ensuring comfort during sexual activity. For those with vulvas, washing the external genitalia with water and, if desired, mild soap is generally sufficient, as the vagina is self-cleaning. For those with penises, washing under the foreskin is important to prevent the buildup of smegma, which can cause irritation and infection. The use of condoms and dental dams during sexual activity is a vital part of sexual hygiene. They act as barriers that prevent the exchange of bodily fluids, thereby reducing the risk of sexually transmitted infections, STIs, and unwanted pregnancies. It is important to use these protective measures correctly every time during sex, including oral, anal, and vaginal intercourse. Regular screening for sexually transmitted infections is a cornerstone of sexual health. Individuals who are sexually active should be tested regularly, even if they do not have symptoms, as many STIs can be asymptomatic. Early detection of STIs is crucial for treatment and preventing transmission to others. It is also important for partners to communicate about their sexual health and share information about STI testing and results. The human papillomavirus (HPV) vaccine is a significant preventative tool in sexual health. HPV is one of the most common sexually transmitted infections and can lead to genital warts and various cancers. The vaccine is recommended for preteens and can be administered to individuals up to the age of 26, providing protection against the most harmful strains of HPV. Lubrication is an aspect of sexual health often overlooked in discussions about hygiene. The use of personal lubricants can prevent friction and tearing during sexual activity, enhancing pleasure and reducing the risk of STI transmission through micro tears in the skin and mucous membranes. Menstrual hygiene is also a key component of sexual health for individuals who menstruate. Regular changing of pads, tampons, or menstrual cups, along with washing hands before and after handling menstrual products, is crucial in preventing infections and maintaining comfort. For those engaging in anal sex, additional hygiene considerations are necessary. This includes thorough washing of the anal area and, for some, enemas to cleanse the rectum. However, it is essential to approach such practices with caution, as excessive use of enemas can disrupt the natural balance of bacteria in the gut. The maintenance of a balanced diet, regular exercise, and adequate sleep contributes to a healthy reproductive system and robust sexual function. Lifestyle choices that enhance overall health also support sexual health, as the body's systems are intricately connected. Communication with healthcare providers about sexual health is vital. Individuals should feel comfortable discussing their sexual history, practices, and any concerns they have with a trusted medical professional. This dialogue ensures that individuals receive personalized advice and care for their specific sexual health needs. Sexual health and hygiene are multifaceted and integral to a healthy and fulfilling sex life. By adhering to good hygiene practices, utilizing barrier methods during sex, undergoing regular STI screenings, and engaging in open communication about sexual health, individuals can protect themselves and their partners. Education and awareness about these topics empower people to make informed decisions about their sexual health and enjoy their sexuality safely and confidently. 6.5 Contraception and birth control. Contraception and birth control are critical components of sexual health, enabling individuals to decide if and when they wish to have children. These terms encompass a range of methods and devices that prevent pregnancy by interfering with the normal process of ovulation, fertilization, or implantation. The choice of contraception is personal and varies based on individual health, convenience, efficacy, side effects, and personal beliefs. Barrier methods of contraception include condoms, diaphragms, and cervical caps. Condoms made of latex, polyurethane, or lambskin are the only contraceptive method that also protects against sexually transmitted infections, STIs. Diaphragms and cervical caps, usually made of silicone, are inserted into the vagina to cover the cervix and must be used with spermicide to be effective. These methods are non-hormonal and can be used on demand, providing a level of control over contraceptive use. Hormonal methods of birth control are highly effective when used consistently and correctly. These include birth control pills, patches, vaginal rings, injections, and hormonal IUDs. They work by altering the levels of estrogen and progesterone in the body to prevent ovulation, thicken cervical mucus, or create a thinner uterine lining. Side effects can vary and should be discussed with a healthcare provider. Intrauterine devices, IUDs, are long-acting, reversible contraceptives that are inserted into the uterus. There are two types: copper IUDs, which release copper to prevent sperm from fertilizing the egg, and hormonal IUDs, which release progestin. IUDs are highly effective and can last for several years, but they require a medical procedure for insertion and removal. Emergency contraception, EC, is a method used to prevent pregnancy after unprotected sex or contraceptive failure. The most common form is the morning after pill, which can be taken up to 72 hours after intercourse, though some pills have a wider window of effectiveness. EC works by delaying ovulation or preventing fertilization and does not terminate an existing pregnancy. Sterilization is a permanent method of birth control that includes vasectomy for individuals with testes and tubal ligation for individuals with ovaries. These surgical procedures are highly effective but are considered irreversible, so they are best for individuals who are certain they do not want children in the future. Natural family planning, NFP, or fertility awareness involves tracking the menstrual cycle to determine fertile days. Couples avoid intercourse or use barrier methods during these times to prevent pregnancy. While NFP is non-invasive and does not require medication, it demands diligent record-keeping and discipline to be effective. Withdrawal, or pulling out, is a method where the penis is withdrawn from the vagina before ejaculation to prevent sperm from entering the uterine environment. This method is less effective than other forms of contraception due to the potential for pre-ejaculate fluid to contain sperm and the risk of mistiming the withdrawal. Contraceptive counseling is an essential service that helps individuals and couples choose the most suitable method of birth control. It involves discussing sexual and medical history, lifestyle, preferences, and future reproductive goals. Access to comprehensive contraceptive counseling can empower individuals to make informed decisions about their reproductive health. Side effects and risks associated with contraception vary depending on the method. Hormonal contraceptives, for example, can increase the risk of blood clots, while IUDs can sometimes lead to pelvic infections. It is crucial for individuals to be aware of the potential risks and to monitor their health regularly while using these methods. Contraception and birth control are fundamental to sexual autonomy, allowing individuals to exercise control over their reproductive health. The variety of available methods means that there are options to suit different needs and preferences. However, the effectiveness of these methods is dependent on proper use and understanding, emphasizing the need for accessible, accurate information and healthcare support. As discussions around contraception continue to evolve, the focus remains on providing safe, effective, and individual-centered options for birth control. 6.6 Sexual dysfunctions and treatments. Sexual dysfunctions are disorders that consistently prevent individuals from experiencing satisfaction during sexual activity. They can manifest as problems with sexual desire, arousal, orgasm, or pain during sex. These dysfunctions can have profound psychological impacts, strain intimate relationships, and affect quality of life. Treatments for sexual dysfunctions are varied and depend on the underlying causes, which can be physical, psychological, or a combination of both. One common category of sexual dysfunction is desire disorders, which include a lack of sexual interest or aversion to sexual activity. Conditions such as hypoactive sexual desire disorder, HSDD, can occur in all genders and are characterized by a persistent or recurrent disinterest in sex that causes personal distress. Treatment may involve counseling, hormone therapy, or medication, as well as addressing any contributing factors such as stress or relationship issues. Arousal disorders, such as female sexual arousal disorder, FSAD, and erectile dysfunction, ED in males, involve difficulty in becoming physically aroused or maintaining arousal during sexual activity. ED is often treated with medications like phosphodiesterase inhibitors, e.g., sildenafil, vacuum erection devices, or, in severe cases, surgery. For FSAD, therapies may include the use of lubricants, estrogen therapy for postmenopausal individuals, or devices that increase blood flow to the genitals. Orgasm disorders, including premature ejaculation, PE, in males, and anorgasmia in all genders, involve difficulty or inability to reach orgasm. PE can be addressed with behavioral techniques, medications, or a combination of both to delay ejaculation. Anorgasmia treatments typically involve exploring psychological factors with a therapist, learning more about sexual response, and, in some cases, using stimulating devices or medications. Pain disorders, such as dyspareunia and vaginismus, cause pain during intercourse. Dyspareunia may be treated with topical anesthetics, pelvic floor exercises, or addressing underlying medical conditions. Vaginismus, characterized by involuntary muscle spasms that prevent vaginal penetration, often responds well to a combination of pelvic floor therapy, vaginal dilators, and counseling. Psychological counseling is a central component of treating sexual dysfunctions. It can help individuals and couples address emotional issues related to sexual health, such as anxiety, depression, and stress. Sex therapy, a specialized form of counseling, focuses on sexual education, improving communication between partners, and addressing specific sexual concerns. Lifestyle changes are also recommended for treating sexual dysfunctions. Regular exercise, a healthy diet, quitting smoking, reducing alcohol intake, and managing stress can improve sexual health. These changes not only have positive effects on sexual function, but also contribute to overall health and well-being. Hormonal treatments can be effective, particularly for dysfunctions related to hormonal imbalances or changes, such as those occurring during menopause or as a result of medical treatments like chemotherapy. Hormone replacement therapy can help alleviate symptoms, but it must be carefully managed due to potential risks and side effects. For some individuals, alternative therapies such as acupuncture or herbal supplements are explored as treatments for sexual dysfunction. While some find these methods beneficial, it is important to approach such treatments with caution and consult with a healthcare provider, as evidence of their efficacy varies and they can interact with other medications. Medical devices, such as penile implants for ED or pelvic floor stimulators for orgasm disorders, provide another avenue for treatment. These are typically considered when other therapies have not been effective, and are usually explored under the guidance of a specialist in sexual medicine. Sexual dysfunctions are varied and can affect individuals at any stage of life. Their treatment requires a nuanced approach that considers the complex interplay of physical, psychological, and relational factors. With the right combination of therapies, lifestyle changes, and, when necessary, medical interventions, many individuals with sexual dysfunctions can improve their sexual health and regain a satisfying sex life. 6.7 Enhancing sexual pleasure. Enhancing sexual pleasure is a multifaceted endeavor that can involve psychological preparation, physical stimulation, and sometimes the use of aids or medications. It's a personal journey that varies greatly from individual to individual and couple to couple. Central to this pursuit is the understanding that sexual pleasure is not just an act but a state of mind and being, deeply rooted in physical health, emotional well-being, and mutual respect and communication between partners. For many, the enhancement of sexual pleasure begins with mental and emotional preparation. This might include the creation of a romantic or erotic atmosphere, the use of fantasy, or the establishment of a mental connection with one's partner. Relaxation techniques such as deep breathing, meditation, or a warm bath can also help individuals become more receptive to sexual stimulation by reducing stress and increasing focus on sensual experiences. Open communication with one's partner is crucial in enhancing sexual pleasure. Discussing likes, dislikes, fantasies, and desires can not only increase intimacy, but also ensure that both partners are on the same page regarding what constitutes pleasurable and satisfying sexual activity. This exchange of information should be ongoing, as preferences and desires can change over time. Physical foreplay is another key component in enhancing sexual pleasure. It can involve anything from kissing and cuddling to massage or oral stimulation. Foreplay helps to build sexual tension and arousal, making the eventual orgasm more intense. For many, foreplay is not just a precursor to intercourse, but an essential part of the sexual experience. Understanding and stimulating erogenous zones beyond the genital area can greatly enhance sexual pleasure. These zones can include the neck, ears, inner thighs, and breasts. Each person's body is different, and part of the sexual journey is discovering which areas provide the most pleasure when touched or stimulated. Sexual aids such as lubricants can increase comfort, particularly for those who experience dryness or discomfort during sex. Lubricants come in various forms, including water-based, silicone-based, and oil-based, each with its own advantages and suited for different types of sexual activities. Sex toys are a popular way to enhance sexual pleasure, either for solo play or with a partner. These can range from vibrators and dildos to anal beads and cock rings. When used safely and consensually, sex toys can introduce new forms of stimulation and excitement into the sexual experience. Physical fitness and pelvic floor exercises can also play a role in enhancing sexual pleasure. Strong pelvic muscles, for instance, can lead to more intense orgasms for all genders. Exercises such as Kegels can strengthen these muscles and improve sexual function. For some, enhancing sexual pleasure may involve the use of medications or supplements. For instance, individuals with erectile dysfunction may benefit from medications that improve blood flow to the genitals. It's important to use these under the guidance of a healthcare professional, as they can have side effects and interactions with other medications. Exploring different sexual positions can provide new sensations and experiences, contributing to enhanced pleasure. Being open to experimentation and being willing to adjust for comfort and maximum stimulation can make sexual encounters more fulfilling. Enhancing sexual pleasure is an individualized process that encompasses a broad range of strategies, from psychological preparation and communication to the use of physical techniques and aids. A healthy sex life involves more than just avoiding dysfunction. It's about actively seeking out and creating experiences that are pleasurable, satisfying, and enriching for all parties involved. With patience, open-mindedness, and a willingness to explore and communicate, individuals can discover what brings them the most sexual pleasure and how to incorporate those elements into their sexual relationships. 6.8 Technology and Sex Toys. The intersection of technology and sexuality has significantly expanded the horizon of sexual experiences through the development and use of sex toys. These devices are designed to enhance sexual pleasure, offer new forms of sexual stimulation, and in some cases, assist individuals with sexual dysfunctions. The evolution of sex toys from simple mechanical aids to sophisticated devices reflects the ongoing innovation in the field of sexual technology. Modern sex toys range from the relatively simple, like dildos and vibrators, to more advanced, like smart toys that can be controlled remotely through apps. These advancements allow for greater versatility and personalization of sexual experiences. Vibrators, for instance, come in various shapes and sizes, each designed to target different erogenous zones and provide different types of stimulation, from gentle buzzing to intense pulsations. Remote-controlled sex toys have introduced a new dimension to long-distance relationships, allowing partners to give and receive pleasure from afar. These toys can be operated via smartphone apps, offering the ability to control intensity and patterns of vibration, which can enhance the feeling of intimacy and connection between partners, even when they are physically apart. The market also includes sex toys that replicate human touch more closely, such as those that simulate oral sex or the warmth of human skin. These toys are often made from materials like silicone that are safe for the body and provide a lifelike feel. The technology behind these toys is constantly improving, aiming to deliver an experience that is as close to real human contact as possible. Sex robots, a controversial and emerging area of sexual technology, present a futuristic vision of sex toys. These robots are designed to look and behave like humans to varying degrees and can include features such as speech and the ability to react to touch. While they are a subject of ethical debate, they represent the cutting edge of how technology is being explored to fulfill sexual and companionship needs. Teledildonics or cyberdildonics refers to electronic sex toys that can interact with each other through the internet. These devices can transmit tactile sensations from one toy to another, allowing for a physical experience that mirrors the actions of a partner. This technology can be particularly beneficial for maintaining sexual intimacy in long-distance relationships. The development of wearable technology has also impacted the sex toy industry. Wearable vibrators can be used discreetly in various settings, providing a continuous, hands-free experience. These devices often come with features such as silent operation and inconspicuous designs, making them suitable for private enjoyment without attracting attention. Sex toy technology has also been integrated into the realm of virtual reality, VR. VR headsets can be combined with synchronized sex toys to provide immersive erotic experiences. This combination of visual and tactile stimulation can create a highly engaging and novel sexual experience. Sex toys are not only used for individual pleasure, but can also be a valuable addition to couples' sex lives. They can be used to explore new types of stimulation and experiences, adding variety and excitement to sexual routines. Couples can use toys as a way to communicate their desires and explore their sexuality together in a fun and safe manner. The use of sex toys can have therapeutic applications as well. For individuals with certain sexual dysfunctions, sex toys can be used as part of a treatment plan to improve sexual function and satisfaction. For example, vibrators can help in cases of low sensation, and dilators can be used to treat conditions like vaginismus. The integration of technology into sex toys has greatly diversified the ways in which sexual pleasure can be achieved and shared. These devices offer novel opportunities for exploration, intimacy, and satisfaction. As technology continues to advance, it is likely that sex toys will become even more innovative, providing experiences that are increasingly sophisticated, personalized, and immersive. With this progression, the importance of education about safe and consensual use of sex toys becomes ever more crucial, ensuring that individuals can fully enjoy the benefits of technological advancements in the realm of sexuality. 6.9 Safety and Consent. Safety and consent are the bedrock upon which healthy sexual relationships and encounters are built. These principles are essential not only for protecting individuals from physical harm and sexual coercion, but also for ensuring that all parties have a mutually satisfying experience. Consent is an ongoing process of agreeing to participate in sexual activities and can be withdrawn at any point, while safety encompasses both emotional and physical aspects of sexual encounters. Consent must be informed, meaning that all individuals are fully aware of the specific sexual activities proposed and the potential risks involved. It must also be voluntary, given without pressure or manipulation. Consent is an active agreement rather than the absence of a no. It cannot be assumed based on past interactions, current relationships, or silence. Ensuring that consent is enthusiastic and clear before proceeding with any sexual activity is a critical step in respecting personal boundaries and autonomy. Communication is key to establishing consent. Partners should discuss their boundaries, desires, and limitations openly before and during sexual activity. This dialogue should be an ongoing conversation rather than a one-time checklist, as people's comfort levels and interests can change over time. A willingness to listen and adapt is paramount in maintaining a consensual and enjoyable sexual dynamic. The concept of affirmative consent has gained prominence in recent years, emphasizing that consent should be a clear, positive expression of willingness to engage in sexual activities. This approach encourages active participation from all individuals and helps to prevent misunderstandings and violations of consent. It fosters an environment where all parties feel comfortable expressing their needs and limits. Safety in sexual encounters extends to protecting oneself and partners from sexually transmitted infections, STIs, and unintended pregnancies. The use of barriers, such as condoms and dental dams, is a fundamental aspect of safe sex practices. Regular STI screenings, vaccination against preventable infections like HPV and hepatitis, and open discussions about sexual health history are also vital components of sexual safety. In addition to physical safety, emotional safety is also a significant aspect of sexual encounters. This includes being mindful of a partner's emotional well-being, avoiding any form of emotional manipulation, and recognizing the potential impact of sexual activities on mental health. Aftercare, which can involve cuddling, reassurance, and debriefing following a sexual encounter, is particularly important in practices involving power dynamics or intense physical activity. The legal landscape regarding consent varies by jurisdiction, but generally includes age of consent laws, regulations against sexual assault, and rules governing specific sexual acts. It is essential for individuals to be aware of the laws in their region and to understand that legal consent differs from ethical consent. The latter requires a more nuanced and personal understanding of respect and autonomy. Digital consent is a relatively new area of concern, as technology increasingly plays a role in sexual encounters. This involves agreements about the sharing of intimate images, messages, and information. Digital consent ensures that personal boundaries are respected online, just as they should be in physical spaces. Education about safety and consent is crucial, starting from a young age. Comprehensive sex education should cover the importance of consent, how to communicate boundaries, and safe sex practices. Empowering individuals with knowledge and skills in these areas can lead to healthier sexual relationships and reduce the incidence of sexual assault and STIs. Safety and consent are not merely legal requirements or formalities, but integral components of ethical sexual conduct. They are dynamic processes that require ongoing attention and respect for the dignity and autonomy of all individuals involved in a sexual relationship. By prioritizing safety and consent, individuals can foster a sexual culture that is respectful, satisfying, and safe for everyone involved. 6.10 The Future of Sex Tech. The future of sex tech is an unfolding narrative of innovation, integration, and ethical considerations. As technology advances, it intersects with human sexuality in ways that are transforming sexual experiences, expanding possibilities, and raising important questions about the implications of tech-driven intimacy. This section will explore the potential directions of sex tech, considering both the opportunities and challenges that may arise. Virtual reality, VR, is poised to become increasingly influential in the future of sex tech. With the capability to create immersive 3D environments, VR has the potential to transform the pornographic industry and personal sexual experiences. It offers scenarios that are not only visually and audibly engaging, but also interactive, allowing users to feel more present within the experience. Future advancements may include haptic feedback suits or devices that allow users to experience physical sensations synchronized with the VR environment. Artificial intelligence, AI, is another frontier in sex tech that is expected to evolve significantly. AI could be used to create more responsive and personalized sex robots or interactive platforms that learn and adapt to an individual's preferences. The integration of AI could lead to more lifelike and emotionally intelligent companions, potentially reshaping the landscape of human-robot sexual and romantic relationships. Teledildonics and remote intimacy devices will likely see further development. These devices, which can be controlled over the internet, enable partners to engage in shared sexual experiences despite physical distances. Future enhancements could include better synchronization, more intuitive controls, and greater sensory input, resulting in a more natural and engaging experience for long-distance couples or interactive performers and their audiences. Biotechnology could revolutionize sex tech through the development of advanced contraceptives, treatments for sexual dysfunctions, or enhancements to sexual health and pleasure. For instance, gene editing might one day be used to eliminate certain sexually transmitted infections or to tailor contraceptives to an individual's specific genetic makeup, minimizing side effects and maximizing effectiveness. Sex tech is also likely to intersect with the wellness industry, emphasizing not just pleasure, but overall sexual well-being. This could include apps or devices that track sexual health metrics, provide education, or offer personalized advice for improving sexual wellness. These technologies could play a role in normalizing conversations about sexual health and reducing stigma associated with sexual exploration or dysfunction. Ethical considerations will be at the forefront of sex tech's evolution. As technology offers new ways to experience sexuality, concerns about privacy, consent, and the psychological impacts of tech-mediated sexual experiences will necessitate careful consideration and regulation. Developers and users alike will need to navigate these issues to ensure that sex tech is used responsibly and respectfully. The democratization of sex tech is another potential development, with technology becoming more accessible to diverse populations. This would involve not only a reduction in costs, but also an emphasis on inclusive design that considers different sexual needs and preferences, including those of marginalized communities and individuals with disabilities. Sex education may utilize technology to provide more engaging and comprehensive learning experiences. Interactive modules, gamified learning platforms, and virtual simulations could offer new ways to teach about anatomy, consent, and healthy relationships, potentially reaching a wider audience with more impactful educational tools. The proliferation of sex tech could also impact social dynamics and relationships. As technology offers alternative avenues for sexual fulfillment, there may be shifts in how people approach intimacy, partnership, and even monogamy. Society will need to adapt to these changes, developing new norms and understandings around technology's role in sex and relationships. The future of sex tech holds a myriad of possibilities that could enrich human sexuality in profound ways. As we look ahead, it is essential to foster innovation while also upholding ethical standards that protect privacy, consent, and well-being. By balancing these considerations, the advancement of sex tech can contribute positively to the exploration and expression of human sexuality.